Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ruth Cabal. Today on the program, the government's no vaccination, no ride policy in public transportation takes effect in Metro Manila today. But some groups and lawmakers are opposing the move, saying it is just an added burden and is anti-poor. Transportation Undersecretary Artemio Tuazon joins us live. And later, the one-week growth rate of new cases in Metro Manila drops to 2%. Has the region reached its peak in cases, or is this just a limit in the testing capacity? OCTA Research Fellow Professor Guido David will join us live. The no vaccination, no ride policy takes effect in Metro Manila starting today. It's the authorities' bid to curb the further spread of COVID-19 by barring those not vaccinated against the virus from using public transportation. The new policy covers travel going to, from, and within Metro Manila, and all forms of public transportation by land, sea, and air. Depending on the type of transportation, commuters will be asked a copy of their vaccination card and other documents. Exempted from the policy are those who are not medically allowed to be vaccinated or those with essential travel. But while some groups in the transport sector agree with the scheme, others say this is just an added burden and is anti-poor. Let's go straight to the source of the story, Transportation Undersecretary Artemio Tuazon. Good morning, Yusek. Nice to have you with us.
Good morning, Ruth. Nice to have you here. Good morning to all your viewers.
So, sir, the no vaccine, no ride in all public transportation policy starts today. We've heard some opposition from different groups. But first of all, can you tell us again why the DOTr is implementing this policy?
Okay, thank you. As we all know, the president about a few weeks ago issued already a proclamation stating that he would like everyone to be vaccinated and those unvaccinated should stay home to prevent the spread of the virus. Also, the MMC, the Metro Manila Commission, had issued a resolution stating that all unvaccinated persons should also stay home. Pursuant to this, the individual LGUs within the NCR had already issued their respective ordinances stating that there should be the unvaccinated people should not be going out of their residence. This is in support of those ordinances and the resolution of the MMC, as well as the call of the President.
Pero bakit po ba nagkaroon ng, you're explaining that based on the MMDA resolution, MMC resolution, pero ano po ang main goal natin? Kasi nangyari lang ito ngayong may Omicron variant.
Yes, basically the main motivation for this policy is health. We are trying to protect the transport system, our public transport system, to maintain it to be safe for all our commuters and also for our commuters to be safe from the transmission of the virus. The data has shown us that most of those that are hospitalized, or a greater majority of those hospitalized, are those unvaccinated persons. And those are the ones that are afflicted with severe to critical cases of COVID. Now, if we allow them, the unvaccinated and the vaccinated, to mix in public transportation, then we are exposing everybody to this virus. So we don't want that to happen. We don't want the public transport system to be the vector for the transmission of the virus.
Okay, Yusek. Now, can you run us through the process kung anong mangyayari pagdating ng pasahero sa isang terminal o kaya doon sa mismong jeep or bus? Paano po yung proseso?
Okay, for our modes of transportation na may mga terminal like the airports, the ports, the rail system, bago pa lang pumasok sila sa terminal or bago pa rin pumasok sa ating puerto or sa airport, chine-check na ng mga gwardiya natin yung kanilang vaccination card. The vaccination card can either be a physical card or yung soft copy ng kanilang vaccination card. This should be presented to the guard together with their government-issued ID para lang to validate kung sila talaga yung nakapangalan dun sa vaccination card. Once they are that is validated, then they're allowed to go in. They are allowed to board their respective public transport. Now, for our road sector, in the road sector where there are terminals that we are using, like the PITX or the other integrated terminals, the same thing is being done. The guards, before they enter the integrated terminals, are checking if they have yung vaccination card nga nila at saka yung kanilang government ID. Or for those like jeeps that do not have terminals, then they're being checked on the road. We have the LTO, the LTFRB, the IAC, the HPG, and the PNP who are going around checking if they are complying, if the jeeps and the buses are complying with this policy.
Yusek, today is the first day of the implementation. Kamusta po ang monitoring nyo?
For our monitoring, everything has been smooth. Of course, there are lines. The lines are not because of the policy. The lines are more of the volume of the passengers that are riding. We have to admit that there's a slight delay, but we also have to state that the delay is a small sacrifice to give for the safety of our public transportation and also for the safety and health of our commuters.
Mm-hmm. So if it's okay on the first day, kasi ang usual concern na naririnig namin, like just this morning, I was interviewing a group of operators and drivers. Baka daw kasi laging magkakaroon ng away yung mga pasahero and then the drivers na why would they ask for the vaccination cards or madidelay yung mga pasahero? Wala po kayong nakitang ganon?
There are still some people. Meron pa rin tayong mga kababayan na medyo hindi ko alam kung matigas lang ang ulo or kung bakit. Kasi actually, Ruth, itong policy na to ay nilabas pa, dapat maging effective pa noong June 12, which is after the date of publication nung policy. But ang sabi nga ni Secretary Artemio Tuazon, to give people the time to prepare at para mapaghandaan na nga itong kanilang pangangailangan ipakita, ginawang effective lang to this Monday, January 17. So I think there should be no reason anymore. Mahaba na yung advance notice sa kanila and they should already be able to comply with this requirement.
But can we talk about the penalties, Yusek? How about yung passengers who would still insist on riding kung wala naman silang maipakitang vaccination card? Or paano kung may kulang? Halimbawa, may vaccination card pero walang ID. And also, yung drivers din na nagsasakay naman ng walang proof of vaccination.
Okay. As far as our department order is concerned, the persons to be penalized or held liable for any violation of department orders are the operators and drivers. Sila yung may obligasyon na i-check yung sasakay sa kanila na mayroong vaccination card at saka ID. Ngayon, as far as the passengers or the commuters are concerned, as you know, the individual LGUs already in the NCR had issued the respective ordinances already. Under these ordinances, nakalagay doon yung karampatang parusa sa mga tao na magpupumilit or magbabiolate ng kanilang ordinansa.
And another concern, how do you make sure na they're not showing, for example, fake vaccination or even fake ID cards?
Okay, totoo yan. There will always be instances where some of our countrymen are very creative and they will present fake cards. But you have to understand, they have to understand, it is their health that we are trying to protect with this policy. It's the health of both the unvaccinated and the vaccinated which we are trying to protect here. It is also both the health of the commuters as well as the drivers and operators of this public transport. So, ang panawagan na lang namin sa lahat ng ating mananakay ay wag na po natin gawin to. Wag na natin pong subukan pa na lusutan to. Kasi po pag nahuli po kayo ay mataas-taas din po ang ating parusa para dito. May fine dun sa LGU ordinances po. Meron pa pong kulong na kasama to. At saka we have to remind everybody, yung pong pagpeke ng ating vaccination card can be held liable under the revised penal code ng falsification of public document, kaya po pwede rin po kayong makulong pag kayo po ay nahuli. So wag na po natin gawin to. Magtulungan po tayo para mapanatiling ligtas ang ating pampublikong sasakyan.
Yusek, we'll talk more about this, especially the plan to deploy mystery passengers or riders. We'll just be taking a short break. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. Our guest today, Transportation Undersecretary Artemio Tuazon. Yusek, this policy has been gaining a lot of criticism. Some groups are saying it's discriminatory, it's anti-poor. How would you respond to that?
Actually, that's true. There are some people who have been criticizing the policy for being anti-poor, for discriminatory. But you have to also know that there are a lot of groups have given support for the policy already because they understand what the purpose of the policy is. The policy cannot be considered anti-poor because, well, who are we trying to protect with the policy? Most of our commuters in the public transport system are those who are in the lower income brackets. These are what you call the poor. Now, if the transport system becomes a vector for the transmission of the policy, we will be forced to close down the transport system. And who will be affected? It will be these poor people who will be affected. If the transmission rises in the public transport system, it will be these people who will be affected and who will be infected with the virus. So how can we consider that under poor? We're protecting everybody here, both the unvaccinated and the vaccinated. We're trying to protect all commuters to maintain the operation of our public transport system.
Another concern, USEC, Labor Group TUCP says this policy is also problematic for the vaccinated. Ito naman yung mga may bakuna. Ang problema naman dito is baka daw kulangin naman yung mga sasakyan. At this point, meron na ba tayong enough public transport?
Yes, from our monitoring this morning, there is a sufficient number of public transport. For trains, they're all there. For the airlines, they're all there. For the shipping lines, they're all there. For the road transport, the same number of units are already plying their routes right now. So we do not foresee a shortage of public transport. We also have to note that there should be no shortage of public transport because in the NCR, the vaccination rate is already very big. So very high, I mean. Hindi na mababawasan yung mga sumasakay sa kanila. Right now, we've also increased the capacity of the public transport, the road public transport to 70%. So there is no reason for this road transport units not to operate their routes.
You're saying that the implementation will be firm. Yun yung unang statement ng DOTr. So how do you plan to go about this? Kasi I remember Senator Nancy Binay saying na paano nga daw yung matututukan yung monitoring mismo if the drivers and the operators are following this policy.
Yes, actually, like I said earlier, we have roving teams from the LTO, LTFRB, the HPG, the IACT, as well as the PNP who are doing the checking for this. Now, what we also have implemented in the road sector is what we call the mystery passenger. These are passengers who are actually part of our teams who ride the road public transport system to check if they are following the policy. Now, if they are not following the policy and they are caught that they are not following the policy, then first they are reminded. If they continue to violate the same, then they will already be apprehended by the enforcers. Si Secretary Tugade has repeatedly said that our implementation of this policy will be tolerant, patient, but very, very firm.
Mm-hmm. We'll go to the questions from our FB Live USEC. Si Jelay Shaga, sabi niya, bakit daw yung first dose hindi pa rin allowed magbiyahe? Please clarify. Siguro kasi hindi pa sila fully vaccinated, USEC.
Yes, tama po yan. Ang kailangan po ay fully vaccinated tayo. Bakit po yung first dose pa lang ang meron ay hindi pa po natin pinapayagan? Kasi nga po ang sinasabi ng siyensya tungkol dyan sa ating unang bakuna pa lang po ay hindi pa po buo ang proteksyon ng ating tao. Kailangan po fully vaccinated. For a 2-dose vaccine, dapat dalawang bakuna na po tayo at saka 14 na araw na po ang lumipas kasi doon po ang sinasabi ng siyensya na doon lang po nagiging epektibo talaga yung bakuna natin.
Another question from Pichi Alberto. How can you teach drivers to check if fake ang vaccine cards? Is there really a way of knowing? USEC, also, we don't have a database to check kung talagang legit yung vaccination card na yun.
Tama po rin yung tanong na po yan. Hindi po ang ating mga drivers ay siguro po ang kanilang magiging checking ay talaga pong visual lang kung maipapakita yung card at saka yung ID po. They do not have any means to check the validity. Ngayon nga lang po, kami po ay humihingi ng tulong sa ating lahat ng mananakay na magtulungan po tayo dito. Huwag na natin pong dayain yung pulisiya, huwag na po natin dayain yung sistema. Para sa sarili po nating kapakanan to, para sa sarili po nating kahulugan to, sa safety at health po natin to. Wag na po natin dayain. Hindi po makakapagdulot na maganda po sa atin yan.
Yusek, I was just monitoring an interview with the ILG Secretary Anyo. He was saying that one of the possibilities is, for example, you're not vaccinated and you attempt to ride public transport. Authorities or local officials can probably bring you to the nearest vaccination center. Pwede kaya yun?
Actually, no. What they are doing now is if you are unvaccinated, you're told to go down of the public transport, the jeeps, the bus, or whatever public transport you're riding. Then if the enforcer is the one that catches you, they usually bring you back home, kung saan ka nang galing. Because also the LGU ordinances state that you are not allowed to go out of your residence.
How about, are there still drivers who are unvaccinated? Pwede ba silang mamasada or pati sila hindi pwedeng lumabas?
Pati po sila, hindi po pwedeng pumasada. Kanila lang po umaga, may mga nahuli po doon tayo mga driver na yung iba po, isa pa lang ang bakuna. So sinasabihan po sila na hindi pa kayo pwedeng pumasada, buuin nyo po yung bakuna nyo, maghintay kayo ng 14 na oras na araw para kayo po ay makapasada. So they are told to go back to their terminals and to stop flying their routes.
But is there a way also to facilitate siguro yung vaccination? Can I don't know, DOTr or any LGU, can they step in and help or assist these drivers?
Yes, actually, Ruth, this is not the first policy that we initiated to also encourage vaccination in the transport sector. Previously, we already had vaccination drives for all our operators, drivers, conductors, and all the transport system stakeholders. We did that before. We had the mass vaccination for them. And I think we can have another one siguro. We will try to see if we can launch another one to help these people. Then of course, there's always the LGU. Alam naman natin ngayon, marami ng bakuna. Hindi na tayo nagkukulang sa bakuna. All they have to do is approach their LGU para ma-schedule na sila na mabakunahan.
Last lang, Yusek, this policy is just while Metro Manila is under alert level 3?
Yes, the no vax, no ride policy will be effective in the NCR as long as the NCR is under alert level 3 or higher.
Okay, Transportation Undersecretary Artemio Tuazon, thank you very much for your time. And coming up, is Metro Manila seeing a decline in COVID-19 cases? We'll speak to OCTA Research Fellow Guido David after the break. Please stay tuned. You're watching The Source on CNN Philippines. New all-time highs in COVID-19 cases recorded over the weekend. The country tallied a new single-day record on Saturday with 39,004 cases. This is the highest since the start of the pandemic and the third straight day that the number hit the all-time high. Active cases also reached a record high on Sunday. Almost 288,000 people are now currently ill with COVID-19. Incidentally, the one-week growth rate of COVID-19 cases in Metro Manila dropped to 2% on Sunday. Has Metro Manila reached the peak of infections? Let's go straight to the source of the story, OCTA Research Fellow, Professor Guido David. Good morning, Professor.
Hi, good morning, Ruth.
Professor, yesterday we had over 37,000 cases. That's lower than Saturday's number. In a tweet, you said this could be a good sign. Can you tell us why?
Yeah, well, actually, I was expecting cases to possibly increase a little further to 40,000 and above. But it's a good sign because if the numbers are not exceeding the projections and in fact are underestimating the projections, that means that there might be some inflection points going on, or what I mean is there might be some trends that are changing already. And in fact, yesterday we saw NCR just tally 16,000 cases, 15,959, and this is much lower compared to the past 4 days. So there's a possibility, and I must stress that right now it's still considered a possibility that cases in NCR may start decreasing.
Why are you saying that it could start decreasing?
Well, we're seeing the growth rate decrease. What that means is there has been a growth rate and it has been positive. And it has decreased over the past few days from 5% down to 3% to 2%. But yesterday, the growth rate was actually -1%. So it was actually a slight decrease. Now, it's too early to call this a decreasing trend. So we'll have to see what happens within the next few days, because sometimes there are data lags, backlog, and late reports. And there's also a possibility that we may have reached our ceiling as far as testing capacity is concerned in the NCR.
But Professor, kasi DOH is also saying that there's already community transmission of Omicron in Metro Manila. What's the implication of that?
Well, to be honest, Ruth, we assume that there has been community transmission of Omicron since the early part of January. In fact, since late December. Once we heard about, transients, skipping quarantine or something like that, most of them come from the US and from Western countries where Omicron is actually prevalent. So if it's possible for someone to bring the virus from the Western countries into the Philippines, then most likely it's going to be the Omicron. And based on the genome sequencing on January 2, Omicron was already, the dominant variant, or it was 60%. So we could think of it as already being dominant. And that plus the other factors, the rapid acceleration of cases, strongly indicates that there's a community transmission of Omicron already ongoing since the early part of the year.
You were saying earlier there could possibly be a decrease of cases, at least in Metro Manila, a decrease in the growth rate because the trend is it's going down. But then the DOH is also saying that the peak might be in January or second week of February. How can you explain that?
Well, of course, the Department of Health uses a different model to make projections. We also use a different model. And right now, it's still up in the air when the peak will happen. So it's not clear yet that the peak is already happening in the NCR. It may be prolonged. And as I mentioned a while ago, there might be also, ceiling in testing capacity, which means that we may not be seeing the true number of cases based on testing. So many factors are in play here. And that's why, we'll just have to wait and see. If next week cases are significantly lower in the NCR, for example, if it's down to 10,000 cases per day, then we can probably say that, yeah, it was already peaking at this time. But if they're still at around the same level or higher, then perhaps, the more conservative model is actually playing out.
You're saying, Professor, that we're probably not seeing the real picture because of maybe limits in testing. And you already mentioned something about estimating between 6 to 15 times higher than the number of cases reported here in Metro Manila, because you did a study in relation to the random tests being done by the DOTr. Can you tell us about that?
Yeah, and this was actually very, very useful, and something that we commended the DOTr for conducting. It's a random sampling of passengers in MRT. So assuming that it's completely random, then there was 12.4% positivity rate among these passengers who were tested. That's about 1 out of 8 random people. And that means, that sort of indicates that if you go out and if you meet 8 people on the road, chances are one of them will likely have the virus. And when we project this to the entire population of NCR, which is almost around 14 million, then this means that taking into consideration the number of cases that were reported from January 1 to 14, that there will be roughly 6 to 15 times higher. The number of actual infections, which would include asymptomatics, and those who don't get tested, and those who got tested with antigen testing that were not reported, the actual number might be 6 to 15 times higher than what is being reported by the Department of Health based on official numbers.
Okay. Last, Professor, you're saying possibly if there could be a decrease in cases in Metro Manila, as what we've seen in the last surge, when this happens, nearby provinces register an increase in cases. Do you see that happening, or is it happening now?
Well, unfortunately, Ruth, it's already happening. Now, in around the NCR and NCR plus, like Cavite, Rizal, we're already seeing possibly a peak that's similar to what we're seeing in the NCR, and that's also the case for Bulacan. But in many other provinces, further out from NCR, they're just starting to register an increase. In fact, Cebu City and Tacloban, in particular, for example, 2 days ago, they reported the highest number of cases in a single day ever. So definitely there's an increase happening in many other parts of the country. This is definitely concerning that, possibly the Omicron has leaked into many of the other provinces in the country.
As always, thank you for your time, OCTA Research Fellow Professor Guido David. And thank you for joining us here on The Source. I'm Ruth Cabal. You're watching CNN Philippines.